Hello everyone, welcome back to the MJ PHYSIO channel one more time. So we're gonna discuss a really general, simple exercise. I'm pretty sure you must have heard of this exercise. I've seen this exercise in a lot of the gyms and then a lot of YouTube videos, but we're gonna do this as an exercise in a little bit different way that actually helps a lot of people who are suffering from low back pain. I know a lot of people do their Monday to Friday and 8-hour sitting jobs, so they probably a lot of people have this issue because of a constant sitting in a one spot and not moving that around, because it really causes a lot of back pains. So it actually helps you to get rid of the back pain of this particular exercise if you can do it at home or gym or any vicinity you prefer. So as you can see, I've already set it up a bench and a stool, and you see my bench is slightly higher than my stool. So which I'm gonna do, I'm gonna keep my upper body, my upper trapezius over here on the bench, and I'm gonna keep my feet on that flat stool which is lower to the bench. And because you see, because my body in the space, really, so a lot of people do this exercise on the floor. You can do it, a lot of older people really prefer doing this exercise on the floor, but this is like kind of a modified way, because which for you it's easy, gives you that momentum, that gives you that space to get your bum more down and work on that glutes and your erector spinalis, your back muscles a lot than you usually do on the floor. So we'll see how it's done.
When you're positioned, you always have that 90-degree angle. It's not like too contracted or like not too like lengthened. So make sure always you have that nice just knee to ankle to your knee and then knee to your hips. That nice 90-degree angle when you're doing it. So try not to get your hips down too much. So all I want you to just dip your hips, and then when you press up and then your head goes up at the same time. Come down, up, 2, 3, and the breathing is same. Whenever you push your body against the gravity, you breathe out, and then when your bumps come down, you breathe in. Make sure you engage the core to have that neutral spine, and you can do the same exercise. Can slightly modify this exercise by adding a little bit of resistance. So I'm gonna add a 15-pound dumbbell on my hips. I'm gonna have the 15 pounds dumbbell sitting on my lap. So I'm gonna just do the same exercise, and you can see my head to my low back, it's a straight line. It's not even hunch or overextension, and I'm not trying to like keep my head like facing the ceiling. I'm trying to keep it at an angle which really stabilizes my back spine.
Some of the wrong techniques that I've seen and also people do regularly of this exercise is that they're always there. Sometimes their head goes up, like when they're starting position, and also their back kind of go over and overextension position. You really put more stress on your back, and then you probably ended up having a back pain instead of having just trying to get rid of your back pain. So make sure you just follow these techniques when you do this exercise. So you don't have to have something specifically, these kind of benches or stools, so you can just do at home, maybe in the bed, at your gym or your own vicinity. Just lie down on a flat surface and have your legs bent. Make sure it's sufficient enough to get your hips up, and when your hips goes up, it has to be like a nice bridge, nice straight line, elevated. And the breathing technique, as we discussed, when your hips goes up, you breathe out, and then it comes down, you breathe in, and always keep your core engaged. That's the only way you can neutralize your spine. And I really hope you enjoy the video, and please do not forget to give us a thumbs up for our MJ PHYSIO channel, and stay tuned for more videos. Thank you.